I've been with PAF for 18 years. It was founded 22 years ago by Nancy Davenport Ennis. She was the founder and CEO. Our mission is to serve one patient at a time. We assist any patient with chronic or life-threatening diseases who are experiencing access to care issues or an inability to afford the treatments that they need. We also do a lot with disability cases, and we want to make sure that patients have access to prescribed health care. We do that through our case managers, and they serve as liaisons on behalf of the patients, working a lot of times with the insurers, the employers, and the creditors to make sure that patients can sustain their health care, their prescribed health care, through a journey with illness. We assist patients with any chronic, life-threatening, or debilitating disease, and that would include diabetes, cardiac conditions, pediatric anomalies, cancers of all different types, stroke, HIV/AIDS. We serve a myriad of issues because the practical barriers that we help with are universal regardless of the type of disease that you're dealing with. When you look at the breakout, we serve everyone from commercially insured to those with TRICARE and government benefits, Medicare, Medicaid, and the uninsured. Usually a patient comes to us when they have already been denied a treatment or a therapy. So we have to peel back the onion to understand what's at the root of the denial. We have to collaborate with the providers to make sure that we have the evidence that we need to work on behalf of the patient. We have to review the benefits carefully to understand what benefits the patients are entitled to and how to address that appeal. We see so many people come to us who fall into the same pitfalls. And so as part of our mission, we want to empower patients. We want to provide global educational resources that will help patients in the future avoid the pitfalls of the past. I think what makes PAF unique in the service that we provide is our commitment to sustained assistance, one patient at a time. We don't just educate and we don't just navigate or inform. We actually meet patients where they are today, and we work side by side on their behalf to make sure that the practical barriers that are preventing them from accessing care are removed. And whether that takes 2 interventions, whether that takes 20 interventions, or whether that takes 40 interventions, we're going to be there with them throughout the entire process.